San Antonio area since 1995, and I've been a nurse for around 15 years. I started with hospice. I've done pediatric home care, nurse education, surgical center, and luckily I've been with this company for approximately 3 to 4 years. Um, with that being said, let me start on this understanding kidney health. Today we will discuss kidney health and prevention of chronic kidney disease, avoiding sepsis, and how to know whether to call your primary care or to go to urgent care or the emergency room. Your kidneys matter because they filter toxins, they regulate your fluids and electrolytes, and help control blood pressure. They produce hormones for red blood cells and activate vitamin D for bone health. Chronic kidney disease, or CKD, means that the kidneys have been damaged or reduced function lasting over 3 months. Many people unfortunately feel normal in these early stages. There's no signs or symptoms. That's why it's important for us to keep going to the doctor regularly so um, they can check you on a regular basis. Chronic kidney disease is divided into 5 stages based on their filtration rate or on their ability to filtrate your blood. Stage 5 represents kidney failure, often requiring dialysis. Now, millions of Americans have been affected or have been suffering with CKD, many without knowing it. Again, early detection is critical, and going to your primary care is important. There are several major risk factors for chronic kidney disease, the most important being high blood pressure and diabetes, smoking, and certain medications like ibuprofen can also increase the risk for kidney disease. Teachers, staff, administrators, and support teams face stress, long hours, and dehydration or skipped meals, all of which can contribute or impact blood pressure and kidney health. Symptoms often appear late, such as fatigue, swelling in the legs, nausea, and uncontrolled blood pressure are warning signs. Controlling our blood pressure is important so that we can maintain hypertension and reduce the damage on our kidneys. Normally, 130 over 80 is what most doctors recommend. Again, your primary care provider will let you know based on your health history what he recommends for you to have on a normal blood pressure on a daily basis. Your A1C, or your target for your glucose control, is a 7%. The higher your A1C, the more damage to your kidneys. So good blood sugar control also prevents the damage to the kidney vessels. Medications like NSAIDs or ibuprofen can damage your kidneys over time. The prolonged use of these medications is not recommended. So if you are someone that is using, for example, ibuprofen to control pain at home on your own, it is important for you to talk to your provider, let him know that you have been using these medications and for how long. Staying hydrated, very important because again, the kidneys are filtering everything in our body, our blood, the electrolytes. Janitorial staff, cafeteria workers, coaches, teachers must maintain hydration to protect kidney function. Smoking worsens kidney and heart disease risk. So if you are a person that is smoking, please try to get some help for you to quit. It Smoking is, like it says, affecting your kidneys, your heart, which most people don't make a correlation with, but it is very damaging to your heart and needless to say, your lungs as well. Chronic kidney disease affects multiple body systems, including blood and bones. Some of the complications include, like it's listed, anemia, bone disease, heart disease. People with chronic kidney disease have weakened immune responses and higher infection rates. Sepsis occurs when infection spreads into the bloodstream and can cause organ dysfunction. The symptoms that you see up on the screen, fever, heart rate increased, confusion, weakness, shortness of breath, all of this require immediate emergency care. So you are suffering with any of these symptoms, whether you know if you have chronic kidney disease or not, those are emergency care symptoms. Dialysis replaces a kidney function in advanced disease. Stage 5 and up are usually where dialysis would start. It is very important, like we mentioned before, for you to have a primary care physician so that they can have routine blood pressure check, glucose checks or your A1C, just regular labs will allow your primary care to understand you as a patient and let you know if there's any risk for any chronic kidney disease. When to use the urgent care? When we have a non-life threatening but prompt needs. Again, some of those included confusion, shortness of breath, palpitations. Those are emergency care or life-threatening needs and have to be going to the ER. In the screen, you see your urgent care facilities. Chest pain, shortness of breath, confusion, not able to have any urine output. Those are all emergencies and require an ER visit. Your blood pressure, again, 180 and above will require ER visits. Your provider will let you know, especially if you already have hypertension or high blood pressure. Your provider will give you specific ranges where he or she would like for you to remain. And usually the provider gives you instructions as to if your blood pressure reaches over this certain number, please call the office and advise us so that we can give you more information as to what to do. It might be as simple as take a second dose of your medications, or the provider might tell you just go straight to the emergency room. Small daily habits that prevent long-term disease include drinking water, taking movement breaks, managing your stress, which I understand is very difficult, regular screenings with your provider. Following these steps will help all of us create friendly habits for good kidney function. Understanding your own numbers, your own health metrics empowers us to have preventative measures. So your blood pressure, your glucose, your cholesterol numbers. The creatinine is also checked just with regular lab work at your doctor office. Medication dosing often requires adjustment in kidney disease, but your provider will inform you of what your kidneys, how they are performing, and if they need to adjust your medication. We do recommend for you to call your provider, your primary care, and let them know if the medication that you are taking, if you don't feel is adequate, or if you're still having symptoms like swelling of your legs, increased blood pressure, let them know immediately so that they can adjust your medications. Early infection treatment prevents progression. So treat the infections early by advising your provider, keeping your hands washed, stay vaccinated. If you are a diabetic, it is important for you to keep infections well controlled. Part of that control comes with you making sure that your glucose levels are low or within range. Untreated UTIs can progress to kidney infection and sepsis. Symptoms of a UTI include burning at urination, frequent urge, or fever. Um, Female can sometimes, even male sometimes can have some abdominal pain or back pain, and it might be your kidneys and not something to do with your back. Dehydration increases kidney stress. Infections can lead to dehydration. Dehydration warning signs are dry mouth, dark urine, or a foul odor smelling urine um, is a sign of dehydration. Dizziness, confusion can all be part of already having symptoms of dehydration. Chronic stress contributes to increased blood pressure or hypertension. It is important for you at work to have an output where you can decrease your stress, whether it's walking, taking a break, moving around. It is very difficult sometimes to do, but it is also important for your own health. So take a break at work. If you feel that you're getting very stressed, talk about it and just move around. Diet significantly impacts blood pressure and kidney load. Excess in salt will increase your blood pressure. That is very important because we don't realize what seasonings we're using that might already contain salt, and then we add salt to our food, increasing the damage to our kidneys and raising our blood pressure. Physical activity improves your blood pressure, improves your glucose. So if you're a diabetic or a patient with hypertension, walking a minimum of 30 minutes a day will be very beneficial. You will see the impact on lowering both your blood pressure and your A1C numbers. Genetic risk, increased monitoring needs. So if you have a family history of kidney disease, heart disease, blood pressure, diabetes, inform all of this to your provider so that he is aware and they can prepare to take measures and do tests accordingly. There's a regular checkup or early lab testing that can detect problems before you even have symptoms. Again, that's why it's important to talk to our providers. Use your employer wellness programs for preventative care. and make sure that you are checking yourself not only for your kidneys, but the once a year preventative programs that are available to you by your work. If you are unsure of which ones your work has, you can always reach out to myself or to the team. Your HR department can also try and assist. Red flags not to ignore. These signs that we're seeing here on the screen warrant urgent medical evaluation, again, an ER visit. So severe swelling of your legs, your hands, confusion, high fever. Dialysis patients must monitor access sites closely. When you have your access site for dialysis, it is important to keep it well covered to avoid any type of infection because it is directly to your main veins. So make sure that everything is covered. And if you see any of, usually they have a tape on your arm. So if it is coming off, tape over it again with the provided tape or Tegaderm that your doctor has given you already. And call your doctor, call your provider, let them know what you see on your dialysis site. Most chronic kidney disease progression can be slowed by taking the correct measures, seeing your provider, and doing the appropriate testing. Controlling our blood pressure, controlling diabetes or our A1C number, avoiding NSAIDs such as ibuprofen, and knowing what correct measures to take can all protect our kidney health. If, again, seek care when you feel that you have some of those symptoms that we mentioned before, confusion, dehydration, swelling of your legs or arms. Thank you for your time. And if you have any questions, again, we will be happy to answer them. Just send them over by email, and Heather and myself can respond to your questions. Thank you, everyone.
Let me put in the chat my email address really quickly, so that way you guys have it. I've also included my email address, or excuse me, my phone number. Okay. We do appreciate you guys joining us today, and hopefully you will be able to join us on April 22nd with from 12 to 1 with our upcoming health talk that we will have as well on allergies and their additional impact. With the ear, nose, and throat, because they impact just more than just the seasonal allergies. And we greatly appreciate you joining us. Thank you.
Thank you.